Hi, everybody. I'm Melinda Gallant, and I want to welcome you to a wonderful Cape Conversations with really a very important person for the town of Sandwich. And she is our social worker here in Sandwich in residence. She works with the police department. She is a lovely person. So come along. Let's have another Cape Conversations. Hi, everybody. I'm Melinda Gallant, and I want to welcome you to another Cape Conversations. Ooh, we got a good one. We've got the town social worker here today, and her name is Parker Monks.
Hi,
Hi, how are you?
I'm good, thanks. Thank you for having me.
Well, I'm excited you're here because I want to know, do all towns have social workers?
Some do.
Yeah,
I think it's a really important role to have, resource
sure,
to have for a community. But
sure.
not all towns have one.
Really?
Yeah.
So, what's your job and what do you do?
So I have a unique role. I'm the town social worker, but I'm stationed out of the Sandwich Police Station. So I work
Oh,
alongside the police station for any mental health or crisis related calls, and any follow ups to get people connected with services. So whether
right.
it's substance use, homelessness, elder issues, anything related to that, that's what I'm available for. And I also am available to work with the different community or programs in the schools.
Mhm.
So I work with Oak Ridge, Forestdale, and Sandwich High School, and I also work with the Council on Aging.
Wow, you've got a big job.
Yeah.
You're juggling all these balls.
Yeah.
So, do you enjoy it? I mean, I know you live in Plymouth, right?
Mhm.
And you're from Plymouth originally,
Yes.
right? So, and now you're here in a smaller community. I mean, we have what, 20,000, 22,000 people.
Mhm.
Um, are you enjoying it? Is it too small? Do you feel like, no, you really got a grip on things?
Yeah, no, I am enjoying it. I mean, I think one of the challenges was initially just getting familiarized with all the different resources and services on the Cape.
Sure.
And that's been a little bit of a challenge, but once I had a grasp on it, it's been easy to refer people to the levels of care, services, or supports that they might need. But yeah, it's been busy.
I bet.
Yeah.
I bet. And you've been with the town for almost a year?
Yes, just under a year.
Oh my gosh, that's great. So what would a typical day be? I mean, we're an older community. We skew older. Um, we have probably maybe a fourth of our homes are summer homes, but otherwise they're year-round residents.
Mhm.
And of course, as I said, we skew older. So what do you typically find, when you come across an issue and how do you help them?
Yeah, so a typical day would be, I come in and I follow up with any mental health related calls or elder issues, like I said, any homelessness,
Okay.
any calls that have come in throughout the evening shift when I haven't been at the police station. I'll do any follow-ups. And any of those calls, I will directly collaborate with the Council on Aging if it has to do with any elder related issues or mental health related issues. And together we kind of work with the individual to get them connected to the needs that they have.
Right. So do you hold I don't know, do you hold office hours and talk to people, or I mean, I just don't know.
Yes, I do. I do have office hours every Tuesday at the Center for Active Living from
Oh, great.
so Tuesday 2:30 to 4:30 and Thursday 10:30 to 12:30.
And what would you like to accomplish? You've been here almost a year now, right?
Yeah.
So you've got time under your belt, and you've seen the community. What do you think are some of the biggest needs, and what would you like to see? Would you like to accomplish, do you think?
Yeah, I would really like people to know that I'm available as a resource. I think since I started, not everyone knows that I'm here and available to
Mhm.
support anyone. So being able to just have better access to the sports and services available to them, and I want to be able to be that person to help bridge the connection between the individual and their needs.
So let us say that my daughter comes to you, or one of my sons comes to you and says, my mom and dad are elderly and they refuse to move, but they really are not in a safe home. Um, maybe they go to the Council on Aging first and then they call you.
Mhm.
Um, what would you get involved in something like that and talk to us, or how does that work?
Yeah, so I would collaborate with the Council on Aging if they had already gone with them. I'd work with the director over there, the outreach coordinator, talk about what services that they might need. If there's any services I can help refer to, whether it's elder-related services for home care, maybe they need services to help make their home safer, or maybe it's they need an out-of-home placement. They need assisted living of some sort.
Right. So, so you deal with all kinds of as I laughed before we started, I said, I think I'm becoming a hoarder. I seriously, I had some women friends in for lunch last Friday, and the one woman walked in, she goes, "Wow, you have so much stuff." I don't mean it's newspaper sitting in the middle of the living room, but I have a lot of stuff.
Yeah.
Do you counsel people with about things like that? And
So, given my role, I can do very short-term counseling,
I
provide them support, and then connect them. So I can be that bridge and for the support until we get them connected to the services that they might need
I
to really address the underlying mental health that might be contributing to
Right,
hoarding.
right. Well, I think my mental health is okay. Well, maybe not. I'm not quite sure. So tell me a little bit about yourself, though. So you grew up in Plymouth. You went to school where?
I went to my graduate school.
Hmm.
I went to graduate school at Boston College.
Oh, you did. So, and undergrad was Boston College.
Undergrad was Northeastern.
Oh my gosh, two really good schools for
Yeah.
sure. Um, and what made you decide to become a social worker?
So I had worked prior to going to grad school. I had worked in residential treatment with at-risk adolescents.
Mhm.
And that really ignited my passion to be able to help that population in a different capacity. So that's initially why I went to school for social work, is to be able to work with children and families, to address all types of trauma, barriers that they might face, and
Mhm.
mental health.
So what is the mental health of Sandwich? Have you assessed it at all? Are we all crazy?
There's a variety of needs.
Yeah.
Yeah.
Which goes from what to what? I mean, just
Well, it can go from
generality.
basic anxiety, depression to more acute psychiatric psychosis, needing higher levels of inpatient or hospitalization care.
Okay. So a couple of weeks ago, um, I saw where there was somebody who was not in Sandwich, but in Bourne, was very distraught,
Mhm.
and a younger woman, and I guess was wanted to take her own life by, I don't know whether it was jumping off the bridge. I'm not quite sure what she wanted to do, but she was in that area. And they stopped her, thank goodness, and I'm sure she got hospital care. Are there signs leading up to all of these things that you can tell us about that we should maybe think about? I mean, you know what I'm saying?
Yeah, I mean, there can be, everyone's different, but
Yeah.
with things like suicidality, there are some things to look for, pervasive hopelessness, if people are getting rid of their personal belongings. There are some risk factors that go along with that you can pick up on, but it's not always predictable. Everyone's different, and some people are more impulsive than others.
Right. So, and if somebody were distressed, is there a number they should call or
Yes, they can call 911 for emergency. They can also call mobile crisis,
Mhm.
and then the 988 hotline.
988 hotline? And that's the mental crisis,
Yes.
isn't it?
Yes.
Yes. Okay. Um, so who besides, I mean, doing all you're doing in the police work, do you deal with maybe women in distress that might have been, have an abusive husband or boyfriend? Do you deal with those kinds of things too?
It depends. There are a lot of domestic violence calls that come through on
Right.
911, and some of those are rooted in mental health.
Right.
And I'm available to assist with those for any de-escalation and connection to services. I do follow-ups with those type of calls too, to try and get anyone that is a victim of domestic violence connected to the resources available to them in the community.
Well, that's a wonderful thing. And the high school, working with the high school, do you go into the high school?
I'll attend meetings there, the weekly student meetings,
Oh, nice.
to work with the school kind of comes together and talks about various needs.
Yeah.
And I'm available to support and collaborate in any way that they need me.
And but you don't work, they don't have like either a person you work with or a club that you work with that has to do with, kids getting along and all of that. You don't do that.
No, no.
Yeah. Okay. And you're located in the police department, which is funny to me. Well, it's a brand new building, so you
It's
must have a nice,
beautiful. Yes.
you must have a nice office.
I'm very lucky. Yes.
That's great. Do you ever get called out on calls with them?
Yes.
Oh, you do?
Yeah, so I mainly work alongside the community service officer, Officer Bonderic. So
Oh,
we'll do a lot of the mental health related crisis calls. Um, or if he's not available and the officers need me for any reason, they can always call me.
sure. Do you deal with the officers themselves at all if they're having a little bit of a down period?
Yeah, if they need me, I am happy to help connect them with supports and resources.
So you're the connector.
Hmm. I'm the bridge.
You're the bridge
Yeah.
to all these other resources. And how are the resources here on the Cape?
They're limited. There's not as many resources on the Cape, but we do have what we have.
Mhm.
But it is more limited on the Cape
So what would be some of the resources?
that are available.
Uh-huh.
There's PHP level of care, so that's a
I don't know what that means.
partial hospitalization program.
Okay.
It's just a higher level of care than basic outpatient. There's intensive outpatient programs. Those can be for mental health and for substance use. There's detox. There's a detox. There's outpatient support groups. There's a lot of different, if you have specific ones, but there's a lot of different support services available for those in recovery or have substance use issues or mental health related concerns.
I see. I see. Um, and back to the schools. So if there's a child in the school that's having issues and the teacher notices it, but the parents maybe don't, do they call you in?
No, so they would work with their school social worker and
Okay,
school
so the
social
school has a
worker.
sheriff, so
Yeah,
and
they
you
would
work
then,
with them.
right. If they need any assistance with helping connecting the family to any type of levels of care or care coordination or in-home therapy, then they would reach out to me if needed, and I
I
can work
see.
with the family.
Oh, I see. I
Yeah.
see. I see. So, you went to Northeastern, right? A city school, and then you went to BU or BC?
BC.
BC. And what did you do before this?
I worked in a variety of different settings,
Uh-huh.
ranging from residential treatment with adolescents to substance use with adults. And I also worked in medical practice as a behavioral health clinician.
Oh my gosh. Then you've got a lot. You look too young to have all these jobs.
Well, thank you. Additionally, I also worked as a telehealth therapist with a company that partners with school districts to get access to the students, mental health access to the students.
Oh, wow.
Yeah.
Is it easier to work with them through telehealth as opposed it is
It has its
one-on-one?
challenges. I mean, there are pros and cons. Some kids feel more safe in their own home environment,
Right.
whereas it's more challenging to engage some that aren't as open to talk therapy.
Right.
So
Did COVID bring that on?
yes, yeah.
That's what I would think. Yeah. Well, my regular primary care physician, for the first time ever, I had a Zoom with her. And it's the first time ever I've had a Zoom with a doctor, you know. She's young, she's new, and I mean, I've met with her physically, but it was a new experience for me because, you know, I mean, she can see me and see each other and we're talking to each other, but it just was kind of strange to me as an older person who'd never done it before.
Mm-hmm.
How do you feel about it?
Like I said, it has its pros and cons. I enjoy it in some ways if it's helpful for the client, and it can be more challenging for those that need more hands-on play therapy. Obviously, for the younger ones, that's tougher. But yeah, there's a missing human component interaction when it's via telehealth.
You know, it seems like today everybody is stressed. Do you think that? Or is it just me?
There's definitely high levels of stress. I mean, I think just coming off of COVID, that's just the impact on mental health overall, and the stressors in the communities have increased.
I just heard this morning on the news that Massachusetts is number 8 in happiness. Hawaii is first, of course.
Yeah, makes sense.
But you're on an island. Nobody bothers you.
Right.
It's very expensive to live there. If you've got a good job, I guess you don't have any stress. I don't know. But that we're relatively a happy people. And yet in our everyday lives, it seems like people are getting angrier. You know, there's more road rage and all of those kinds of things. What do you think contributes to that. You must have some thought about it.
Yeah, I'm sure that there's a mental health component to that.
Yeah.
If you're struggling with anxiety, you have a smaller window of tolerance. If you're struggling with sleep, if you're struggling with depression, you're more agitated. There's lots of factors that can contribute to what you mentioned.
Yeah. So what is we talked about what your typical day would be like. So where do you move now? What happens now as you grow this practice? It's like a practice, isn't it, almost?
In some ways,
Yeah.
yeah. Yeah, I'm hoping just to continue to improve the community's access to services and increase safety in the community, and help people with the areas that they need help with.
Oh, that's great. That's
Yeah.
wonderful. And have you found the people in Sandwich welcoming, or are some of them like, go away?
No, I haven't found that they've
Oh,
been like,
great.
go away.
Yeah.
No, they've been very welcoming.
Oh, that's great.
Yeah,
That's
I'm really
wonderful.
happy to be here in this community.
Right. Um, well, I would imagine it would be interesting working with the police too.
Yeah.
Sometimes interesting and sometimes sad.
Mm-hmm.
Now, how do you not be sad about that stuff?
It's everyone, I'm human too, but working in the field for as long as I have, I've really worked to cope with how I deal with what I see on the job, and what I deal with can be heavy, but self-care in my own personal time is so important in order so you don't get burnt out in this field and really let everything you see affect you.
Right. So you almost like a duck, you have to let it roll off your back somewhat, huh?
Yeah.
Well, I've always wondered, like firefighters and police officers, I don't know how they deal with
I know.
car accidents and fires and
Yeah.
all of that. Would you direct them? Do they have their own social workers, or would you be a part of that?
So I'm available to them if they need anything.
I see. So that's part of the job too.
If they need anything, I'm here.
Yeah.
But I can help give them referrals to any resources that might
Right.
help them cope better.
Right. Wonderful. So, excuse me. So now you've been in the job almost a year, and you're working with the COA, right? Council on Aging, right? At the COW,
Yeah.
as we like to call it. Do you have meetings there regularly with them, or with folks there? Do you ever come in and talk to them about certain things, to the people who belong to the COW, or older people here in town?
No, not necessarily. If someone wants to meet with me, like I said, I can meet over there. I have office hours over there each week. But I meet regularly with the director or the outreach coordinator over at the Council on Aging.
I see. Excellent. Good. And so here we are. You've been here almost a year. And how do we get a hold of you if we want to get a hold of you?
So I have a number and an email, and I have walk-in hours at the Center for Active Living or Council on Aging.
Yeah. And so what would your email be?
My email is pmonks, MONKS, @sandwichmass with 2 S's.org.
And your phone number? Slowly.
My phone number. My work cell is 774-413-0801.
And what are the office hours at the COW?
Tuesdays 2:30 to 4:30, and Thursdays 10:30 to 12:30. I want to make sure I get those right.
Well, what's so important too, I would think, is that Christmas is coming, right? And that's the time when people get depressed, especially older people, I think, because, families are far away.
Sure.
It's not like the old days when we all used to live together in the same town and in the same house.
Right.
And what would you tell somebody who was maybe feeling a little bit down? I know you have resources for them, but you must also have an idea of what you might say to somebody who says, yeah, I'm really feeling kind of down and out.
I would just try and talk to them about the things that they do enjoy and trying to get them to access, whether it's interacting more with people that they are connected to, doing some of the things that they do enjoy doing, trying to get a routine for them. Sometimes when you're feeling down, it can really affect your motivation, you wanting to sleep more, and not do the things that you need to do to really feel good. So I would talk to them about those things.
And which would be a part of self-care?
Absolutely.
Okay.
Yeah.
All right. Good. Wonderful. Well, thank you so much. It's been
Yes.
a delight to talk to you.
Thank you.
And I wish you the best.
Thank you so much.
And I hope you don't have to come to my house because my kids call you because they say I've become a hoarder. I'm really not a hoarder. Well, I got a lot of stuff, but it's more memories. And I live with an artist, so
Okay.
so now I have I have paintings that seem to be everywhere, which is not a bad thing, not at all. So anyway, again, thank you so much. Welcome to Sandwich. A little bit late, but welcome, and I wish you the best.
Thank you. I'm happy to be here.
Thanks. Parker Monks, our local social worker. Wow, what a wonderful young woman. And she brings so much to the job and to the position. She works with the Council on Aging at the CAL and has office hours there, but she also has an office at the police department, working with a lot of things that are probably pretty stressful. So I was amazed at how wonderful she is and what good job she's doing. So thank you so much. And I'll see you next time on another Cape Conversations.